Urgent question, Jonathan Ashworth.
He asked the Secretary of State to make a statement on NHS funding.
The Secretary of State for Health, Secretary Jeremy Hunt.
Thank you, Mr. Speaker. Compared to 5 years ago, the NHS is responsible for 1 million more over 75s. In 5 years' time, there will be another 1 million over 75s. Our determination is to look after each and every NHS patient with the highest standards of safety and care, but there is no question that the pressures of an ageing population make this uniquely challenging. So I welcome the chance to remind the House of this government's repeated commitment to support our NHS. The NHS budget has increased in real terms every year since 2010. NHS spending has increased as a proportion of total government spending every year since 2010 and is 10.1% higher per head in real terms than when we came to office. The OECD say our spending is 10% higher than the OECD average for developed countries, and at 9.9% of GDP it is about the same as other Western European countries, for which the average is 9.8%. But given the current particularly challenging circumstances, in 2014 the NHS stepped back and for the first time put together its own plan for the future. It was an excellent plan based on the principle that because prevention is better than we need to be much better at looking after people closer to or in their homes instead of waiting until they need expensive hospital treatment. The plan asked for a minimum of an £8 billion increase in NHS funding over 5 years. It asked for this to be front-loaded to allow the NHS to invest in new models of care up front. And following last year's spending review, I can confirm to the House the NHS will in fact receive an increase of £10 billion in real terms over the 6 years since the 5-year forward view was published. In cash terms, that will see the NHS budget increase from £98.1 billion in 2014-15 to £119.9 billion in 2020-2021. A highly significant rise at a time when public finances are severely constrained by the deficit this government regrettably inherited. Because the particular priority of the NHS was to front-load the settlement, £6 billion of the £10 billion increase comes before the end of the first 2 years of the spending review, including a £3.8 billion real terms increase this year alone. That £3.8 billion real terms increase represents a 52% higher increase in just 1 year than the party opposite were promising over the lifetime of this Parliament.
Jonathan Ashworth.
I'm grateful, Mr. Speaker. This morning, the Chair of the Health Select Committee and her colleagues said the government's NHS spending claims were, quote, inaccurate and false. Mr. Speaker, we on this side of the House agree with that analysis. Ministers, and the Secretary of State has done it again, tell us they are investing £10 billion more in the NHS. It has now been confirmed this figure is, quote, not only incorrect, but risks giving a false impression that the NHS is awash with cash. Isn't it the reality, Mr. Speaker, that this government has cut adult social care, they have cut the public health budget, has cut the NHS capital budget, and now we learn that the average amount we spend on healthcare for each person in this country will actually fall in 2018-19. Doesn't this raise serious questions, Mr. Speaker, about the claims ministers and indeed Prime Ministers have been making from that dispatch box? In fact, the only way that the government's figures could be further discredited, Mr. Speaker, is if the Secretary of State slapped them on the side of a bus and got the Foreign Secretary to drive it. So will the Minister admit that they have not actually given the NHS the money it needed? Will he instead give us an accurate account of the spending plans for the NHS? Will he tell us when the Chancellor is going to respond to the Health Committee's letter and what representations he is making to the Chancellor ahead of the autumn statement? And we've also learnt today from the Health Service Journal that 1 in 3 local areas intend to close or downgrade A&E departments within 18 months. 1 in 5 expect to close consultant-led maternity services, and more than half plan to close or downgrade community hospitals. Will the Secretary of State confirm whether these reports are accurate? The answers we need to know are how many A&E departments, how many maternity units, how many community hospitals does this Secretary of State expect to close or be downgraded within the next year and a half? These are the questions our constituents want. Mr. Speaker, before the last election, the Secretary of State told us he was confident of delivering the money the NHS needed. Today, that confidence has been exposed as utterly misplaced. His Tory promises are completely in tatters. So rather than defending the Prime Minister's spin on this £10 billion figure, why doesn't he stand up for patients and staff and deliver the funding the NHS and our social care sector desperately need?
With around 80% of trusts in deficit and only about 4% meeting A&E targets, I am grateful for the Health and Select Committee for flagging up the dire financial state of the NHS in England, as evidenced by their letter to the Chancellor. We learn from this document that the £10 billion figure is in fact a bit of a fallacy. In Scotland, the SNP government are committed to investing an additional £2 billion by 2021, but any reduction in new money for the NHS from the UK government would impact on Barnett consequentials. And given the UK government have already slashed Scotland's budget by 10% between 2010 and 2020, the UK government needs to be honest and transparent about what this means for Scotland's funding. With the Department of Health having accidentally not adjusted its books for an extra £417 million from the NI contributions and having brought the Department of Health control total by £207 million, will the devolved governments get any share of this additional £624 million?